Two people living in New Hampshire were on board the cruise ship at the center of a deadly hantavirus outbreak. The health department says they're not in New Hampshire right now and there is no threat to the public. But we're learning one American who was on the ship has tested positive and another is showing symptoms. Jesse Mitchell tonight explains the quarantine protocol.
Aerial cameras captured a couple from the MV Hondius cruise ship arriving in Atlanta in full protective gear before they were taken to Emory Hospital.
One individual was deemed to be symptomatic on evaluation prior to leaving the Canary Islands. One is undergoing treatment and the other one is undergoing further evaluation and monitoring.
Health officials say more than a dozen other U.S. citizens from the hantavirus-affected cruise ship were admitted to the University of Nebraska quarantine unit Monday.
We've been doing symptom monitoring as well as temperature checks. Everyone here is asymptomatic.
At least one who tested positive for the Andes strain of the virus remains in biocontainment for close observation.
We assessed that individual. They are doing well, actually. They currently do not have any symptoms.
The rare Andes variant of the hantavirus linked to the cruise ship outbreak has the potential to spread between people. CBS Evening News anchor Tony DeCopel spoke with Dr. Jay Bhattacharya, director of the National Institutes of Health and acting director of the CDC, about the government's response so far.
Why haven't we seen daily briefings on the hantavirus the way we did around COVID?
You know, the epidemiological risk is very, very different. It is a more deadly disease if you get it. But unlike COVID, it's the way that people get it from person to person is much, much more difficult for that to happen.
Hantavirus symptoms can include fever, chills, and muscle aches, which can take up to 2 months to present themselves. Jesse Mitchell, CBS News, New York.
A Massachusetts doctor was once a patient at the same isolation unit in Nebraska. Dr. Rick Sacra was treated there after contracting Ebola on a medical mission more than a decade ago. The Holden family physician spends several weeks a year seeing patients in Liberia. And back in 2014, he was evacuated from the West African country to be treated at the biocontainment unit in Omaha. He recalls the feeling of loneliness being away from his family and seeing only medical staff in full protective gear.
Ebola generally has a 21-day, limit on post-exposure isolation or quarantine. Hantavirus is even longer, up to, I've seen quoted numbers between 6 to 8 weeks. So that's a long time. This was not anybody's fault, not anybody doing something foolish. It's just how things are, and thank God we have the ability to diagnose and the ability to provide good care.
Dr. Sacra admits he felt relieved when he learned Americans from the ship would be treated there. He describes it as the best, safest place for these patients.